I think more people do have symptoms than realize. I think what happens is they don't always realize that it's menopause. And then they also start getting diagnosed with all sorts of other things, which are actually menopause related, probably like mood disorders, all sorts of like random rheumatologic autoimmune things. A lot of these things are really just exacerbations due to their hormone fluctuations. And so some of the problem is the patients don't realize it and their physicians don't.
Hi, I'm Dr. Avanti Kumar-Singh, and this is the Healing Catalyst podcast. I'm a medical doctor with over 20 years of experience and also a lifelong practitioner of Ayurveda. I created the Healing Catalyst podcast because we all deserve a different kind of conversation about health, one that's honest, holistic, and rooted in both science and soul. On this show, I'm joined by the world's leading experts to give you science-backed tools that you can start using today and actually stick with to build real health and longevity. I am so glad you're here. Now let's get to it. Welcome to the Healing Catalyst podcast. I'm Dr. Avanti Kumar-Singh, a physician and Ayurvedic practitioner, and my mission with this podcast is to share science-backed and time-tested tools to help you make simple, meaningful lifestyle shifts that improve your health, your vitality, and your longevity. If you're in perimenopause or menopause and feeling confused about hormone replacement therapy, wondering whether it's safe, if it's right for you, or if a more natural approach might be better, this episode is for you. Today, I'm joined by Dr. Suzanne Gilberg, an OB-GYN integrative medicine physician and menopause expert who's helping to transform the way women experience midlife. She's board certified in both integrative and holistic medicine and also holds a clinical Ayurvedic specialist degree. She's also the chief medical correspondent for the Drew Barrymore Show, author of the Menopause Bootcamp, and currently serves as chief clinical officer at Monarch, where she's helping reimagine women's healthcare. Today, we're bringing clarity and compassion to one of the most misunderstood topics in women's health, hormone therapy. We'll unpack what the science really says, when it's most effective, and if it's ever too late, and how to determine if it's right for you. We'll also explore the lifestyle and mindset tools that support this transition, from nutrition and sleep to stress management and the deeper emotional and spiritual work that Ayurveda describes as part of this sacred transformation. And stay tuned until the end because Dr. Gilberg shares one of the most powerful reframes on menopause that I've ever heard, one that centers freedom, authenticity, and a renewed sense of self. Let's dive in. Suzanne, thank you so much for joining me today. I'm really excited to talk to you about hormone therapy today.
I am so excited to talk to you about anything.
You're so sweet. You're so sweet. I'm really excited because I think that this is a topic that so many women are so confused about. Just
Yes.
What are the options? What do I think about? How do I make a decision? This is what I hear from women all the time, my friends, my patients, my students, right? So you are the perfect person to talk about this. So I really want to just dive into this because, hormone therapy for so many women, especially women of our age in their 40s, 50s, 60s, it's carried a lot of fear because of that WHI study, right?
Yes,
And so
yes.
I think it's really important for us to sort of separate out the myths from the facts and really talk about the truth. And so let's first start before we go into the WHI study. Let's start with just the basics.
Okay.
What exactly is hormone replacement therapy? Can you explain what that is?
Yeah. Well, first of all, I'm going to dial it back even a little bit further.
Yeah.
Why would we consider hormone replacement therapy? The reason is during our reproductive years, the years in which we could potentially reproduce, should we choose, we are making a cocktail of cycling hormones, okay? The ovaries are largely responsible for producing these hormones. And it's not the only place that estrogen comes from, but the main place that estradiol, which is the dominant estrogen form, because estrogen is not one thing, is coming from. And so our ovaries are really in a conversation long-term with our brain. Our brain is setting off start initiating conversation, helping the ovaries produce in sequence estrogen and progesterone, right? And it's really biologically driven. It has nothing to do with identity or politics or
Mhm.
feelings. It's an evolutionary process of how we reproduce. So the estrogen is helping to select a follicle from which an egg will be released when it does not get fertilized. Progesterone is made just in case, progestationally, in case we do conceive, to help support that early pregnancy. And then when we don't conceive or have a fertilized egg, everything drops off. We shed the lining of our uterus and we start over. Okay. So we have very large amounts of actually much more progesterone than people realize, especially in the second half of the cycle, lots of estrogen. We also have a lot of testosterone. Okay. So that's what's going on from roughly age, 11 or 12, whenever you started your period, to your 40s or 50s when you stop having a period. Now those hormones have gone away. But the thing is, these hormones are not responsible only for the capacity to reproduce. They're not only affecting the ovary, the uterus, the vagina, the obvious quote reproductive structures, but we have estrogen and testosterone receptors in every cell of our body.
Mhm.
And I think most of us really think of these hormones, even though they're called sex steroids. Sure, they are responsible for sexual characteristic development and for reproduction, but they are really neuroendocrine hormones. They are impacting your brain. They are impacting your bones. They are impacting your gut. They are impacting the lining of your blood vessels. They are impacting muscle, joint, on and on and on.
Right.
So when the ovaries stop making estrogen, because essentially they've run out of their egg supply
Right.
and the egg quality has declined enough that it's just not going to happen anymore, that's when you stop getting a period if you have a period, right? If you have a uterus, and you enter into menopause or postmenopause, whatever. The terminology gets confusing too, right? So now
Mhm.
you're done, which means you're really not making any estradiol at all. And you're not making progesterone anymore. Testosterone declines very, very substantially as well.
Mhm.
So the idea behind hormone replacement therapy, menopausal hormone therapy, whatever the hell you want to call it, it's
Right.
just words. The words are powerful, but I'm not going to get into all that,
Sure.
is because we are losing the impact of those hormones on our entire body. And in
Mhm.
an era where women outlive their menopause by
Right.
substantially, 30 to 40% of your life is going to be lived postmenopausally. There are really serious health impacts and quality of
Sure.
life impacts in
Mhm.
not having those hormones present anymore. So I think it's really interesting for us specifically as physicians who also are trained in ancient holistic medicine, the
Right.
original medicines, to be
Mhm.
honest. We really
Mhm.
have a broader and a deeper perspective.
Sure.
But I think that there is I personally think it's a false dichotomy that there's a natural way to do it and there's a pharmaceutical or somehow bad way to do it or an unnatural
Right.
way to do it. And I really don't, I think that's false. I
Right.
mean, the reality is that despite the fact that there are some evolutionary benefits to menopause, and there's evidence that throughout history, women definitely lived longer than menopause. The vast majority of women probably didn't. And the reason that the women who lived past menopause were elders and were wisdom holders is because they were still alive. So there's
Right.
definitely an advantage, elder women in the community. And this isn't a new thing, but it is
Right.
new that such a huge number of us survive past this. The reality is most women died in childbirth until like 100 years ago, like not
Right.
that long ago.
Right.
So so that's not natural either. You and I are wearing glasses. My friend Kelly Casperson likes to say that's not natural either.
Right.
So the next reason that we would look at this is that there's the obvious symptoms that so many people talk about and hear about during perimenopause.
Right.
Everything from brain fog to hot flashes to joint pain to vaginal dryness. And these are really impactful in terms of your day-to-day living and deserve attention. Hormones are not the only way you can address these things, but hormones are the most effective way
Right.
because it's the loss of hormones that is causing it.
Right.
But the thing that I think people do not understand and really is important is that this is a portal to the rest of your health. So we're not talking about just lifespan, but something called health span. Lifespan is
Mhm.
how long you live. Health
Right.
span is how long you live in health. Women live about a decade longer than men, but in much poorer health.
Mhm.
So we're looking at the development of cardiovascular disease, the number one killer of women, osteoporosis, which affects 1 in 2 of us, fractures, which can kill us in the first year, dementia. And we know that by adding back some of these hormones, we're going to decrease the risk of these things substantially. So I think, again, it's not the only way to do it. It is a very specific and important tool in the toolkit.
Right.
There's nothing that's going to replace estrogen. Estrogen, it replaces estrogen. That's it.
Right.
Phytoestrogens, herbs, which I love, they
Right.
are not a replacement for estrogen.
Right.
So I think if you understand that and you have a fully educated, supported conversation with resources and time, you get to make the decision.
Right.
I always say to people, in medicine, we talk about informed consent. If you do not have the information, it's not informed consent. It's not
Right.
informed without
Right.
information.
It's not informed.
And fear is not information. Fear is
Correct.
frontal lobe shut down. Like,
Yeah.
seriously. That's
Exactly.
science. That's science.
Yeah, yeah. No, and I really appreciate that you went through that because I think that's such an important thing to start with is really understanding, okay, what is actually happening here? So
Right.
why is it such a big deal and why do I need to think about this,
Right.
right? So that's the
Right.
place to start.
Right.
But let's back up then to this WHI study
Yeah.
because
Yeah.
this is what's caused so much of the
Yeah.
problem, especially
Yep.
for physicians of our age.
Yeah.
We were in training when this was all going on, and suddenly everybody was afraid to
Yeah.
prescribe any kind of hormone. So,
Yeah.
what exactly was this WHI, the Women's Health Initiative study, and what did it find? What do we need to sort of correct as far as the myths go around that?
Yeah. Well, the thing about the Women's Health Initiative is that was born of some really positive findings and also like this really beautiful moment where Bernadine Healy, the first female director of the National Institutes of Health, wanted to see if they could reproduce the data that was already out. So I actually was trained a little bit ahead of you because I was in my first year or two in practice after residency when this came out. So I was trained in an era where hormone therapy was done. I mean, I have this very specific memory of learning about the nitrous oxide pathway for vascular dilation, which is a really important part of cardiovascular health, and how estrogen helped to decrease the risk of heart disease in women who are on it. So we had a lot of data already, and it was on hormone therapy that was used at the time, which is not exactly what we're using now. But we had lots and lots of data, and Bernadine Healy said, hey, let's really do a study devoted to this specifically. We're going to put $1 billion into this. It's going to be the biggest study we've ever done. And let's look at what it does. But then the problem with the study was how it was designed, because instead of bringing in women of average menopausal age or entering into that transition, the average age of women was 62, which is 10 years past menopause. So this wasn't looking at women who were in the menopausal transition. These were women who, a very, very substantial number, already had heart disease or risk factors, some of whom had heart attacks. I mean, like, it just wasn't the same population. So I don't see how you can even take the results and apply it to a 45-year-old. And the endpoints were really more around cardiovascular health. At a certain point, they were looking at the data and they used some calculations that were really manipulative, specifically at an increased risk of breast cancer. Okay. And they said that there was a 23% increased risk of breast cancer. Well, that was the way the data was analyzed. First of all, women who are older have a higher risk of breast cancer. Okay. So already we're not looking at a 51-year-old. We're looking at women in their 60s and 70s who we already know have a higher risk of breast cancer. Okay. That's number one.
Right.
Number two, when you looked at the raw data, the increased risk for breast cancer was less than 1.8 women per 10,000 users. I mean, you can make that statistically significant. That's not clinically significant. When you look at, let's say it's 1 in 10,000, but the risk of cardiac disease is 1 in 2.
Right.
And there are other weird political things that happen too, because of the 40 investigators, only 3 were told, hey, we're going to do this press conference.
Right.
And nobody else, I mean, there was just a lot of weird politics involved. It's very unclear why any of this happened. And since that, and there's a lot of really great data that came out of this, Avanti, a lot of great data, a lot of data that supported decreased risk of cardiovascular death, actually osteoporosis. Actually, there's some really good dementia data in here.
Right.
Women who were on estrogen only because they didn't have a uterus and didn't need to use progestin, not progesterone, had decreased risk of breast cancer. So, and in the 25 years or so since that time, breast cancer risk hasn't decreased. It's increased. So 42% of women were on this Prempro, okay, on hormone. This the most common use of hormone replacement at the time in 2002, 4% now. So massive, massive decrease in use and an uptick in every single other medical issue. So, hello, it didn't do anything good for anybody. It scared people. It took a tool out of the toolkit that
Right.
is so important. It There's so much misogyny and ageism baked into this. It's really a
Mhm.
sad story. We continue to mine that data because it's still a huge data set and there is a lot of interesting data that came out of it. Like I said, that's very positive. So I'm not mad at the Women's Health Initiative, but I'm mad at the way it was manipulated and used to scare women and scare doctors. At this point, if you're a practicing physician and you're still quoting the negative stuff from there, like you're just not keeping up. Like that's just, I'm sorry, that's lazy.
Right.
But if you and I
Right.
were raised by moms that were scared and said to you, "Don't ever do this," and then everybody was told,
Right.
"Oh, I got breast cancer because I was on hormone therapy." It's like, oh
Exactly.
my God. It's very hard, these stories. I was just actually on the phone on a Zoom call with one of my dear friends and mentors, Carol Tavris, who's the co-author of Estrogen Matters, and a dear
Mhm.
friend and colleague of Avram Blooming, who they really blew the blew the top off of this story, I think.
Sure.
And we were talking a lot about this. She said to me, "Information doesn't change minds, stories do. But
Mm.
science requires evidence." She's brilliant. That's a quote. She said that to me like 2 hours ago. I wrote it down. And I think it's important. It reminds us why telling these stories, talking to each other, but also trying to ground ourselves in the evidence and in the facts, which change over time, is so important.
Right. And so and that's so true. And I think the story that is just lingering is that hormone therapy causes breast cancer. And that
Right.
is the only story that anybody can think about, right? And that's what we're sort of up against is let's write that story, right? Like
Yeah.
let's rewrite that story. So I think
Yeah.
that's the issue. So let me ask you this question with regard to hormone therapy because there's a lot of talk about this. A lot of women are very confused about like when is it most effective to actually start it? There's all these differing opinions and sort of this discussion, and I know we've even had this discussion of what's the ideal window for starting? Like,
Yeah.
once you hit, quote, "menopause" and you're in postmenopause, is that too late? Because I think part of the problem is a lot of women don't even know that they're in
Right. Right.
premenopause,
Right.
right? That
Right.
they should even think about this. So let's back up and think
Yeah.
about, like, when is the right time to start?
Great question. Well, first of all, something I've been contemplating recently is that I think there's a couple of cultural conversations at play here that we don't always acknowledge.
Sure.
And I mean, I think I really am, look, I'm interested in the science of it for sure, but I'm so, so interested in the culture and the
Sure.
narratives around this. Like, ultimately, I think that's probably what interests me the most.
Yeah.
And one of the things I've noticed in this, like, fear now, like, "Oh my god, I need to start it. Did I what it am I" is this
Right.
whole perfection narrative. Like, you have to do it this way, and it's like, "Guys, take a breath, take a beat." Like, there's no one
Mhm.
way to do anything, and, yeah, there are some things that are better than others and some things that are wrong, but like, you're not gonna this whole idea of control, like, we really need to continue to examine this. So I really
Mhm.
want people who are feeling really jacked up and anxious about this to maybe, like, downregulate their nervous system a little bit, seriously,
Yeah.
take a deep breath, and maybe take a look at what is this fear about? It's a fear of, like, you're gonna die, you're gonna do something wrong. I
Mhm.
get that. But, like, the fear of doing something wrong, we really need to move away from, and for me, acknowledging it is helpful.
Mhm.
Having said that, we have a big problem because in the wake of the Women's Health Initiative, we basically had no funding going toward menopause research. So we have all these different formats that we use. We have actually some really strong, large observational data that's not the same as the gold standard we call placebo controlled, double blind prospective trial. It's a very specific
Mhm.
way we do things, but the money wasn't there to do it because everything got moved away. And we had such a small amount of money is budgeted in the NIH budget toward women's health at all, let alone menopause. So we
Mhm.
don't have all the answers specifically, but we do have a
Right.
lot of observational data. It looks like the sooner the better you start, but
Mhm.
certainly within the first 10 years after your last period, it seems like you will get those long term health benefits. That's really important to know. I think in terms of when to start, I think it's a conversation you need to have with your practitioner, who is hopefully a really experienced practitioner. For
Mhm.
certain, if you're having symptoms, it doesn't matter if you're having a regular period or not. But if you're having symptoms and we have excluded other reasons, there's no reason to not start hormones. That's really basic. I think for
Right.
someone who's more than 10 years past menopause, who's having symptoms and doesn't have any like major contraindications, I think it's totally acceptable to start hormones. I've started hormones in women who are in their 60s. There's
Mhm.
no evidence to support that it's unsafe. There's no evidence to support it will decrease their risk of heart disease, osteoporosis, or dementia. Okay. That's really important. So that's broad, and I can understand why that's confusing to people.
Right. So that's the issue, is that there is so much confusion. A lot of women feel like, "Oh my god, I missed the window. Like,
Yeah.
it's not gonna help me. I won't do
Yeah.
it." And then they get talked out of it, get
Yeah.
talked into it. Like, there's so much confusion, right,
Yeah.
about where do you start? And then also, if you throw in the breast cancer piece, right? If you
Hmm.
have a history, if you have a family history, like I just went through breast cancer, there are all
Right.
these questions. Like,
Right.
is it better to do hormones with having had breast cancer? Or do you need to protect yourself against osteoporosis? There's so many things that you have
Yeah.
to consider, right?
Yeah. Yeah, definitely. I will say, I think more people do have symptoms than realize. I think what happens is they don't
Mhm.
always realize that it's menopause. And then they also
Right.
start getting diagnosed with all sorts of other things, which
Mhm.
are actually menopause related, probably like mood disorders, all sorts of like random rheumatologic, autoimmune things. A lot of these things are really just exacerbations due to their hormone fluctuations. And so some of the problem is the patients don't realize it and their physicians don't. And then they end up in
Right.
polypharmacy, 5,000 meds. And people who already have a history of, let's say, autoimmune disorder or a GI disorder or a mood disorder, they're going to have episodic flaring. I mean, listen, for your listeners, it's important for them to know if they know their own personal history and they're seeing, like, why all of a sudden is it not under control anymore in your 42? It might be because it's perimenopause. So that's really, I think the more we educate our patients and the community, they can advocate for themselves.
Right.
So some of this is just that kind of confusion. And again, I would posit that most people are having symptoms. They just don't realize it's symptoms. And I think that is the time to at least start having a conversation about hormone therapy. For the
Mhm.
women who are 10 years past, it's just, it's really, it's individualized therapy. And again, risk benefit. For
Mhm.
breast cancer, family history, a family history of breast cancer is not a reason that you can't use hormone therapy. If you have an increased risk of breast cancer based on your family history, that doesn't change being on hormone therapy. You still have an increased risk. So I think you need to understand you have other benefits. It is not a open and shut case. And I think there's a lot of fear-based decision making going on in the medical community. And again, I understand why, although I did call
Yep.
them out for being lazy, because it's like, you guys, at this point, it's so abundantly clear. And if it's not in your wheelhouse, just say, you know what, I just don't feel comfortable with this. Let me refer you to this person who's an expert.
Right.
For those of us who have had breast cancer, it's a more complex conversation. It's a conversation that's evolving. If you're currently being treated for your breast cancer, no, you're not. You should not be using systemic hormone therapy. You can use vaginal hormone therapy, and you should be offered that for urinary symptoms and vaginal dryness. It's absolutely safe. There's evidence to show it's safe. It's just like, again, shouldn't be a conversation, but I have this conversation
Mhm.
all the time. People's doctors are telling they can't be
Right.
on them, and absolutely false. And it's urinary symptoms that are not only bothersome, but that can lead to bladder infections, kidney infections, sepsis, death in older women. This is not uncommon.
Right.
Well, what are we doing? So that's a no-brainer. I think the conversation around hormone therapy in people who have had early stage breast cancer and are well past their treatment, I'm
Mhm.
one of them. I changed my mind based on the research. I'm on hormone therapy. And here's the interesting thing. I made a switch to a combination medication called Duave, which is conjugated equine estrogen, the old school Premarin that people like to
Mhm.
crap on. Turns
Right.
out it's pretty good in a lot of ways, with, instead of progesterone or a progestin to protect the lining of my uterus from over exposure to estrogen, there
Mhm.
is a selective estrogen receptor modulator called beta-doxyphene. What does that mean? It means it's the receptors are selective based on the tissue they're in. So in the uterus, beta-doxyphene is anti-estrogen. Great, protects the uterus. At
Mhm.
the breast, it is anti-estrogen. It protects the breast. At the brain and the bone, it is positive or neutral, right?
Mm.
So there's a trial called the Promise trial coming out of Northwestern, actually.
Mhm.
And the preliminary data was reviewed at ASCO, at American Society of Clinical Oncologists, a couple months ago. Very promising. People with precancerous lesions,
Mhm.
ductal carcinoma in situ, were shown to have decreased progression, and it's being looked at specifically for decreased recurrence.
Mhm.
This is powerful. That's the medication that we chose for myself. That's actually the medication I choose for my patients who are at higher risk for breast cancer or who had breast cancer and are done with their treatment. And I think the data is going to bear out that it is not only a safe choice, but an excellent choice because it's protecting your bones, it's ostensibly protecting your
Right.
brain and the rest of your and decreasing your symptoms and everything else. So I think
Right.
that's really exciting.
Yeah. No, it's really important for all of our listeners to hear is that this is not just a question about breast cancer. You have
Right.
to ask questions beyond that. And I
Yes.
think that's what you're trying to say. So here's what I would ask. What is one question that every woman should be asking her doctor about hormone therapy?
I think honestly, the question is, do you prescribe hormone therapy? And seriously,
Yeah.
is this something that you are proficient at, is in your
Mm,
wheelhouse? Or do you have someone a colleague that you really trust? I think we always want to continue to have like an open dialogue and a partnership. And I understand why patients are frustrated and even angry. Coming in a combative way is going to make your doc, who's already under the gun and probably doesn't have enough time to keep up on literature, let alone do your PAP and then answer your 15 questions at the PAP, that they're getting paid $80 for. Like seriously, these are human beings. We have to have compassion. So make it easy on them, make them your friend. And if because they're more likely to be honest and be like, it's just not my thing, or like, oh yeah, I do it all the time, and make an appointment dedicated for that. Can I make the other question is call the staff. Ask the staff, does he or she do
right.
this? Can I make a dedicated appointment to have a conversation?
Right.
And then the last thing is it's not protocol driven. It's individualized.
Right.
If you're 42 and you had preeclampsia, versus you're 65 and you just went into menopause 4 years ago, it's not the same conversation.
Right. Which I think goes to your point that it's so important that question of asking your doctor, is this something that you do? Do you
Yeah.
have experience? Because it is so nuanced and it is so personalized, you
Yeah.
need to have somebody who knows what they're doing.
Yeah.
And it's okay that not every doctor is a
Right.
specialist. It's just like not
Right.
every doctor is a specialist in eye surgery or
Right.
bone surgery, whatever it is, or oncology. It's okay to go to a specialist who understands
Yeah.
menopause
Yeah.
and hormone therapy. That's okay,
And it's really hard because we have access issues as it is just like getting in
for
with a
sure.
physician. So I again want to really acknowledge how hard it is and that also everybody
Mhm.
can't afford to do these things. But the telehealth options, a lot of them are quite good and quite affordable. I think some are better than others, but they're definitely out there. And I think it's a good place to start if you're having a hard time finding a physician or a nurse practitioner locally who really treats this. And I will tell you that I think that our nurse practitioner colleagues are killing it.
Yeah,
They're really doing a great job.
yeah, yeah. And we'll make sure that we link some of those resources in the show notes for all the listeners so they
Yeah.
know where they can get that help
Yeah.
if they need it. So let's turn to sort of the bigger picture and some of the things that, we wanted to talk about, which is lifestyle, sort of how do we take this integrative approach, right? Because it is so much more than hormone therapy.
Right.
And because hormones don't exist in isolation, right? What we
Right.
do on a daily basis affects our hormones, right? We know this. So, how do you feel factors like lifestyle and stress and sleep, how does this all interact with our hormones for menopause?
Oh my God. They are so closely linked. First of
Mhm.
all, you can't outpatch your lifestyle. You know what I mean? Like referring to an estrogen patch. I mean, you know what I'm talking about. But
Yeah.
you can do hormone therapy. And if you don't do any of the rest of it, nope. That's not how it works. So
Mhm.
it's not like one or the other. I mean, lifestyle is not an option. Like you have to be attending to it. And that's what ancient wisdom has always told us,
Yeah.
right? But
Yeah.
we also understand now the interactions, and there's so many interactions we don't understand. But if you look even like Ayurvedically, the gut is the seat of our health, right? Agni, digestive fire. They knew what they were talking about. Now everyone's like, microbiome. Great,
Right.
cool. They were
Yeah,
talking about that like 6,000 years ago. It's awesome that you guys
exactly.
caught up. But it is very exciting. The
Right.
microbiome is freaking fascinating. The gut is so cool. So one of my favorite teachers and mentors is Emran Mayer, who's a totally renowned gastroenterologist and like really, I feel like brought the microbiome to the public. He's written a bunch of books. And he says that if you spread out the entire gut lining, it would be as big as a football field.
Yep.
That's how big. That is literally the way we as humans interact with our environment in every possible way. So the gut has a big impact on hormones. It's producing a large majority of our neurotransmitters, our immune system. Of course, it's how we assimilate our nutrition and turn it into absolutely everything. And it turns out that estrogen in particular is metabolized in the gut. There's something called the estroblome, which is the microbiome that is devoted to estrogen metabolism. We don't really understand all of it, but we know it
Hmm.
happens. So we know that our gut function changes in perimenopause and menopause under the influence of shifting and then declining estrogen levels. So this is another reason why like really attending to our gut health, our nutrition,
Hmm.
and of course our gut health and nutrition isn't just what we're eating. It's what we're consuming, right? I just told you it's neurotransmitters. It's your stress, it's your
Yep.
sleep, it's your movement.
Right.
How are you assimilating nutrition to build and maintain your muscles and your bones? These
Hmm.
things are so, so, so important. And look, taking hormone therapy probably makes it easier to do a lot of these things, but you can do it without if you have to or you don't want to. But you have to stay on top of like your sleep
Hmm.
hygiene, your seasonal variation and how you're eating, what's available, your consumption of media. Consumption is not just
Yeah,
food, it's the relationships, it's the
exactly.
energy, it's how you're dealing with what's coming at you. It's like, look, this is not the easiest time in the world to be alive. When was it ever? It's just in our face in a really different way. And
Right.
how we choose to process that, how we choose to take breaks, what we choose to expose ourselves and participate in is really a matter of life and death. Social connections have been shown to be really highly correlated to our health. And the Surgeon General produced evidence in the last couple of years showing that isolation and loneliness are more dangerous than cigarette smoking. So these are, again, all things that we know: community, spirituality, which is a way for us to connect with something larger than ourselves and decompress and release stress, give it to God, whatever you're saying is.
Right.
Like, it really does have positive benefits. For women specifically, strength training, building those large muscle groups, which are metabolic drivers. So they're going to help us use our energy and build muscles, which will keep us strong, help us balance, help our bones stay strong, help us move around so we can get up out of the bed by ourselves
Hmm.
and go to the bathroom in the middle of the night without falling over. It also decrease our insulin resistance, decrease our visceral fat, which is inflammatory. I mean, I could go
Right.
on and on. So
Right.
all of this is all related to lifestyle.
Yeah. And I think that their point is so well taken that it's so much about consumption of everything, right? I always say that our health is not based on what we do in the doctor's office or what choice we make just today and never do it again, right? It's about everyday life. It's about everything that is coming at us 24 hours a day. And
Yep.
how are we processing it? How are we digesting it? What is
Yeah.
the state of our digestion, right? And so I think that's what you're also speaking to.
Yeah.
The other thing that I've really been thinking about is the cultural framing of menopause. Like menopause is having its moment right now. Like we both
Right.
know that, right? It's all everybody's talking about it, which is wonderful,
Right.
right? But I think that, what the other healing traditions and sort of Ayurveda, Chinese medicine, all of these other healing traditions have always looked at this time, actually all of the different transitions in a woman's health span as a sacred transition.
Yeah.
And in the United States and in Western culture, it has so long been looked at as, oh, you're on the downhill. Like you are over. Like that's your life is over. You know, and so I feel like there's a cultural framing, sort of a rebrand almost, right? That's
Yeah.
happening
Yeah.
with menopause, right?
Yeah.
How do you feel about that? Like, and what do you think about this reframe that's going on?
Well, I think anytime we're having a conversation about what we're doing and we're having some cultural introspection, that's a good thing.
Mhm.
I think it's really interesting and I think it's really important. I think to me, I mean, my perspective is that a return to a little bit more of an ancient way of thinking about this, I think that's good. Let me just say that. So, when that meme was going around where they were showing the Golden Girls at 53 and the Sex and the City girls at
Oh,
53.
yeah.
And I
Yeah.
was actually like super offended, to be honest. Because I was like, why are we hating on these ladies who were like looked old? It's
Mhm.
so misogynist and so ageist. Like I fully appreciate what this meant, but it also is not embracing, in my opinion, of feminine power. It is, oh,
Mhm.
see, we're still young and sexy. That's great. You want to be young and sexy? I'm not hating on you. Do you? Like, I
Right.
don't care. Like, I also like, dude, I was giving a talk and I don't know, it just came out of my mouth. Shocking. But I was like, I'm in my sexy crone era. That's how I feel. My hair is gray. I'm doing my thing. I feel great. Like, I'm
Mhm.
not saying like, no, don't be sexy. I'm just saying like,
Right.
why are you trying to make it like, oh, 50 is the new 20? Like, that is not advancing anything, in my opinion. I
Mhm.
think it's absurd. I think it's missing the point. I think to me, I remember a teacher of mine talking about for her menopause, she created this whole ceremony. Like she literally like cocooned herself and like went into a space separate from her family for like a long period of time and literally like reemerged. And it was so interesting and amazing. And I don't know if it was anything traditional or not. Like I
Mhm.
don't know if she just like came up with this or there was, but I do think that this idea of a time of like slowing down,
Mhm.
withdrawing, self-care,
Right.
transformation, some of which is painful,
For sure.
letting go of things and then reemerging as a new version of yourself
Right.
and yet another iteration of your authentic self. To me, that's more powerful. I
Yeah.
also see there's been something very interesting for me having been through this return to our pre-cycling self is really interesting as like a
Mm.
return to authenticity. Think about little girls before they know that anybody's watching them for any reason other than they're the shit. They're
Yep.
not
Yep.
objectified yet. They're not aware of that. They're not sexualized. They're not
Right.
sexual. And they're just doing
Mhm.
themselves.
Right.
That's so beautiful. They're not doing it for
Mhm.
anybody's gaze at all.
Yeah.
And then we get into cycling and it's a necessary part. Again, like that's also,
Right.
it's not that's better than this, which is better than that. It's these are
Right.
different versions of ourselves. It's
Right.
accepting our authentic self at the time and place that we are at. And I think that the beauty for me, and I think for a lot of us of aging and being in our authentic self and feeling our power is accepting who we are at that time. The
Mhm.
transformation for me has been spectacular.
Mhm.
I'm not easy,
Of
not
course.
easy,
Yeah.
spectacular.
Yeah, well, and I think what you're speaking to, first of all, I've never heard it put that way. So thank you for sharing that. That is profound. And I really need to think about that because it is so true. It's sort of that return to when you were younger and you just didn't give a shit about what anybody thought. Like so many of us our age are having this conversation of like, I don't give an F of what anybody thinks about me anymore. Cause I'm at that age, like I'm just gonna do me, right?
Mhm.
That is how we were when we were younger. I've never
Yep.
even thought about that.
Yeah. I've
But
been thinking about it a lot.
it's amazing.
Yeah.
It's a really good frame. But the other thing that I think you're speaking to is, in that beautiful story you told about this woman reemerging is this reframe of thinking about it as a beginning
Yep.
rather than an ending.
Yes.
Because we have been indoctrinated to think of it as like that's the end of your reproductive years. And so
Yep.
that's the end of your importance or whatever the hell you wanna call
Right.
it, right?
Uh-huh.
It's
Yep.
actually the beginning. It's the
Yep.
beginning of a new phase, right?
Yeah. Yeah.
That I think is really important and pretty profound, and I think that is the next sort of iteration of the conversation we need to have,
Yeah.
right?
I
Which
agree.
is what I think you're getting at. That's really
I agree. And I think
powerful.
what I'd like to see more of is people who don't identify as like sharing the same philosophy around this, having these conversations. Cause I think what happens often is there's this like, you're doing it wrong. And I saw
Right.
this a lot in the birth world. Like,
Mhm.
look, my career has been super interesting. And I think because I've done OB-GYN,
Mhm.
I've just lived and breathed like women's transformations and lifespan and like in real time. I was like
Yeah.
going through with my patients and I saw this a lot in the birth world
Mhm.
in, 25 years ago where there was a conversation bubbling up about physiologic birth, which was really important and really necessary. But
Mhm.
also this division of like, you're doing it wrong if you do it
Right.
this way, and you're doing it right if you do it that way, whichever the way is. And I do see that happening in menopause too. And it's the same group of people. So maybe there's something with our generation. I don't know. But could
Mhm.
we maybe not do that?
Yeah.
Like,
Right.
why does it matter to you how I do it?
Exactly. And I think the point here is really to have all of the information,
Yeah.
have a well-rounded information so you can make your own decisions, right?
Yeah.
Because I think part of the problem is that so many of us don't have the information,
Yes.
the truth about what hormone therapy is, what are the options, what are the benefits and the risks, right? We have
Yeah.
all these stories of, oh,
Yeah.
it's going to cause breast cancer,
Right.
and that's all we think about, right? Or that's
Right.
all we hear. And so we're not getting the full picture, right?
No.
And so
Yeah.
let me ask you this, from an Ayurvedic sort of integrative perspective, is there a practice that you have found that is especially helpful for women who are premenopausal, postmenopausal, menopausal, sort of something that you think is really transformative? I mean, I know there's a lot that you talked about, but is there one that you could pick out that you think has really been helpful?
Like an Ayurvedic practice?
Yeah, Ayurvedic,
Ooh.
integrative, whatever. Yeah.
I mean, I think it depends on the person, but I do
Mhm.
find that one of the things that I think is most powerful are the body work. And
Mhm.
in my book, in Menopause Boot Camp and in my menopause boot camps, I always teach self Abhyanga.
Yeah.
I like it for a couple of reasons. First of all, I think it brings us literally back in touch with our bodies. And one of the problems that we have in modern life and in women's bodies is we are so dissociated from our bodies. We're asked to dissociate so many ways. It's really hard to be in our bodies for a number of reasons, physically discomfort, culturally, like just
Mhm.
fear, whatever. And I do think that there's, even though like I don't necessarily bring it up as this, I look, the act of Abhyanga, right? So just for your listeners, is it's a very specific way of oil self massage. Okay.
Mhm.
You can also get it, if you can get it by practitioners, even better. But there's something
Mhm.
about touching yourself. First
Uh-huh.
of all, you're releasing oxytocin. Touch releases hormones that are love hormones. And there's something about loving yourself.
Right.
And also like touching your body and like being like, oh, this is me. This
Mhm.
is who I am. This is my existence. This is where I am residing during this period of time, right? There's just
Right.
all these things. And then it's also just good for you. It's really good for your skin. It's really nourishing. It's really self-loving. There's a lot of benefits if you put something in the oil. It's a way to bring
Yep.
medicine into your body. So I think it's a really simple way for people to encourage a different relationship with themselves as they're entering into a different relationship with themselves. There's
Mhm.
something kind of
Yeah.
symbolic about it.
Yeah, it is. I mean, and sneha, which is the word for oil, is also the word for love. And
Yeah.
so there is no coincidence there, right? This is a self-loving practice. This is what I teach
Mhm.
women. I was just at a retreat with 12 women in France, and I was teaching them about Abhyanga, and they're all women who are in this stage. And I said exactly this. I said, Abhyanga is a self-loving practice.
Yeah.
And it literally means, Sneha means oil, but
Yeah.
also means love. And
I
so
love it.
I love that's the practice that you really feel is so
Yeah.
transformative. The other thing that I wanted to ask you about is, what's the role of community and connection, do you think, in this stage of life for us as women?
Huge. It's everything. Okay, so another story. 6 years ago, I was interviewed by a dear friend who's 20 years my senior on menopause publicly. And during that conversation, I had a like aha. And I was like, "Oh my gosh, we lost the conversation. We aren't." The fact that it was an intergenerational conversation, the audience was also intergenerational. It really was profound for me, and I couldn't let it go. And I knew I needed to do something about it. And that's when I came up with Menopause Boot Camp.
Mhm.
And it was a combination of that and also like I was getting so many questions. And anytime I'd give a talk, people would ask me and in the office, and I was like, oh my God, I can't possibly download all the information in 2 seconds. And so I said, I've got to create a space for that.
Sure.
So I created Menopause Boot Camp, 3 to 4 hour experience, movement, education, terminology. I thought I'm doing a service for the public. What I realized was, yeah, the education was important, but the community was the most important thing. First of all, these women
Mhm.
wanted to now have a Facebook group and talk to each other.
Yep.
I created a community for myself. I wound up making some of my closest friends. I never had close friends that were colleagues. I always had
Mhm.
girlfriends, but I
Yeah.
never had close friends that I talked to every single day, that I have traveled with, that know my secrets,
Mhm.
other menopause experts. I created a community. I wound up in a community for myself that supported me through this process. I cannot tell. I mean, it's everything, because the rest of it does not happen without community. There's a reason we're herd animals.
Right. Right.
We don't survive without each
Right.
other.
I mean, I often say that the whole point of coming back to earth, I believe in reincarnation. That's my culture, my religion, right? But for me, the whole point of coming back to earth is to be in connection with other people, to be of service to other people. And so
Yep.
for me, it just makes sense from a medical standpoint. That is such an important part of your health. I mean,
Mhm.
connection is medicine, right? That is medicine.
Oh my God, absolutely. The medicine is in the connection. Look,
Yeah,
you and I, as people who have practiced for a long time, we know. We're smart, we know things. I can do surgery and I can prescribe things and I can come up with a diagnosis, but honestly, at least 75% of what I do is just listen and connect. And
exactly.
it's mutual. These are people that
Yes.
I love and love me, and that is the healing. That's the energy. I mean, healing is energy anyways.
Right.
We're
Right.
just energy bodies.
Yeah, exactly. Exactly. Yeah, I think I'm taking it all in because I'm so excited right now. Um,
Well, it's always so
yeah,
good to talk to somebody who, like, gets what
yeah,
you're talking.
I mean, and you are, you're a leader in this field, and so to hear you validating that, and also, I really want the listeners to hear that. I mean, Dr. Gilberg is an expert in menopause. She's one of the leading experts in this field right now in the in the Western world. So for you to be sitting here talking to me about the fact that energy matters and that connection matters and that we need to have a cultural reframe. This is powerful. Powerful for me personally, but I hope powerful for everybody who's listening because I want you to all to hear that it's hormone therapy is really important, but it's even bigger than that. It's
Mhm.
bigger than that.
Oh, yeah.
That's really what I'm hearing. So, I have a couple other questions that I mean, we could talk forever, and I
Yes.
know I
Well, we'll
can't
do it
do that
again.
with you because you got some patience, but we'll do it again. But I have a couple questions I wanna ask you because I think that, again, connection is the whole point, and for me, having this podcast is about connecting to you as a practitioner, but also for for the listeners to connect to you, and so I wanted to ask a couple questions that will help them get to know you in a little
Okay.
bit of a different way. Is that
Yeah.
okay?
Yeah, of
Okay.
course.
What is one thing that you do each day to support your own well-being?
Okay, I start every morning with hot water, ground flaxseed, and lemon juice. Really, it's, like, very simple. It's very nourishing, and it's my little ritual. I get up. If my cats don't come up to, like, whine at me like, "Hey, mom, we're hungry," then I go downstairs. They get all excited. This is every morning. They run downstairs with me. They get in my feet. I turn the hot water on. I feed them. I make my flax water. It's fabulous. I do that every day. Even if whether or
Amazing.
not I meditate that day
I
or
love
I
it.
do yoga or I exercise, I do that.
That's amazing. I love it. What is a book or maybe who is a teacher that's deeply influenced how you think about women's health? You've mentioned a couple, but who would you say?
Yeah. Wow. I mean, there's so many over the years, but I would say what's influenced me the most in terms of my medical thinking, but also cultural, because the story of the Women's Health Initiative is a story about cognitive dissonance. And actually, one of the co authors, that is her area of specialty.
Mhm.
So I would say Estrogen Matters is the book that probably influenced me the most in the last 5 to 6 years
Mhm.
on both the granular and, like, big picture level.
Love that. What is one thing that you wish every woman knew about her body?
That it's a gift. It's not a
Mm,
curse, it's a gift. The gift doesn't always mean you like it all the time, but, like,
right.
it's like why we're here, you know? And try, like, is there a way you can make friends with your body?
Mm, yeah, I love that. One last thing. So, I call my podcast The Healing Catalyst because the whole point of this is to help people make really impactful changes for their health. So, along those lines, if there's one thing that you want every single woman that's listening to this episode to walk away remembering, what would that be?
I don't know. I know it's probably maybe it's a little generic, but just like stay curious and open and try not to get like locked in. Like my thinking has changed about this over the course of my career and over the course of my own personal experience. Like I came into my 40s, like having studied Ayurveda. And I remember thinking, I wonder what I'm going to do. Like, am I going to be natural or am I going to take hormones? And then I got breast cancer in my 40s. I was like, well, okay, I guess I'm not, that's answered. I'm not taking hormones. And then I changed my mind and took hormones. Like, what can I say? Like, I'm a very, very inquisitive person. And I think critically about information. I think those are good qualities to move us through lives. So maybe stay curious, stay open, think critically about the information that you are presented with.
Suzanne, thank you so much. I love talking to you.
Oh, yeah, same. Avanti, thank you so much for this. I mean, what a great conversation. And thanks for having this podcast.
Oh, absolutely. Thank you again. What an incredibly powerful and deeply moving conversation with Dr. Suzanne Gilberg. There was one moment that's really stayed with me. Her description of menopause as a return to our pre-cycling selves, to that little girl version of us who was completely authentic, not performing for anyone, not self-conscious, just fully herself. That reframe, that menopause is not an ending, but a return to authenticity, is something that I've been thinking about a lot because it reminds us that this stage of life isn't about loss. It's about coming home to who we truly are without apology or expectation. And so, whether you choose hormone therapy, a natural path, or maybe a blend of both, you deserve care that honors all of you, body, mind, and spirit. If this conversation resonated with you, please share it with another woman who might need to hear it. And if you haven't already, please follow the Healing Catalyst podcast wherever you listen so you don't miss a future episode. As always, thank you for listening and thank you for being part of this community. And remember, healing isn't just possible, it's in your power. I'll see you next time. Until then, be well. Thank you for listening to The Healing Catalyst. If you found this episode helpful, please hit follow and share it with a friend. And if you feel inspired, please rate and review because it helps others find this podcast more easily. For more insights and tips, head to my website at avantikumarsingh.com. And to connect with me directly, find me on Instagram at Avanti Kumar-Singh. I loved sharing this episode with you. My hope is that you heard something today that sparks a catalyst in your healing journey and helps you build lasting health. Be well, and I'll see you next time. This is a Dante 32 production.